All right, we're on and we're recording. This is a recorded interview with the 2023 Advisor of the Year, Dolores Shupp Byrne. And so thank you so much for spending a little bit of time with us today in your very busy schedule. I know we've talked about how busy you are today. So thank you so much for spending a little bit of time. So we'll probably go a little bit quicker than a lot of our other conversations, but hey, that's fine. So just briefly, Dr. Shupp Byrne, tell us about your journey to be a professional and a pre-health advisor.
Okay, so basically, I grew up in Bethlehem, Pennsylvania, went to parochial schools, went to an all-girls school. My parents believed that education was a means to success and that women should be educated. And with that in mind, I went to college. In my earlier days in high school, I was very interested in the sciences and participated in the Lehigh Valley science fairs. It was always a big deal for us in high school and won a few along the way. And so I decided that I was going to study biology. And so I went to a very small school near home. I lived there. As a matter of fact, it was an all boys school. It was Allentown College of St. Francis DeSales. It was only open about 5-6 years. And I was the first of 24 women to enter into that man's field. And with that, I studied biology. We started out with 70 individuals in our class and graduated only 11.
Oh boy.
Yes, PhDs, doctors, MDs, both allopathic, osteopathic teachers, even directors of clinical labs. And so it was a very good education. Small school, got all the attention I needed. I applied to graduate studies. I liked anatomy, so I applied to University of Pittsburgh School of Medicine. In those days, it was medical sciences. Remember, in the age of dinosaurs at that time, and science was just exploring. My area of concentration was cell biology and gross anatomy. And with that, I studied connective tissue studies, looked at used somatic cell genetics to map proteins, connective tissue proteins, collagen to chromosomes. At that time, that's all we had. And I looked at a new form of collagen in the embryonic state, but I used teratomas to look at that. And so it was an exciting area. I became known a little bit for being good at making monoclonal antibodies to detect proteins in tissue. And I moved on to my postdoc. And as I moved on to my postdoc, I came to Thomas Jefferson University, at that time, Jefferson College of Medicine, and basically went to the Department of Biochemistry to study immunology and work on the T cell receptor. And after a few years, I went out to Haverford College, assisted the chairman in the biology department. And at that time, a lot of students, female students from Bryn Mawr, were coming over to do some of their senior thesis studies. And so I worked with them. And then I got a call back from Thomas Jefferson because prior to going to Haverford, I also did some work in the urology department. Okay. And they asked me to come back, the urology department, and be part of their research group, which was only 2 of us. Hugh Callahan was there at the time. And I basically did work for Grant Mulholland and why the bladder remains at a sterile state. Okay. So now here comes the advisory. Even as a graduate student, my professor used to bring in, which was Bob Church. He used to bring high school students in who were working on science fair projects. And we would give them our facilities. I would be the mentor for them. And they would work in doing their project, which was totally different from ours. And they would work in their projects, and I would help them with techniques and be their mentor. So when I got to urology uh, in our basic science research lab, my chairman believed that residents should participate in basic science research for at least 6 months of their career during their residency program. I had residents. I also took in the first year medical students that summer. So I had summer interns. And I also opened my lab to college students and high school students in the city of Philadelphia. It was always a big interest for me to have students explore on the benchtop the STEM. And with that, I did a lot of mentoring along the way, including my technicians who worked on our projects. I felt that they should advance their education and not just have a bachelor's degree. So I helped put through at least 5 master's students, and 2 of them went on to get their PhDs. And so I've always been excited about that. And as time went on, I kind of had my share of basic science research, and I started doing other things within the Department of Urology. And it was basically being an advisor for education in urology. We have, for the medical school, 7 elective courses for the 4th year, and in the 3rd year, we have their clinical rotation. And so with that, I did some advising for our residency program, did interviews for residencies every year that we would select, and I still do that. And it has been in the urology department, I would say 33 years and 2 years in my postdoc. Okay.
Mm-hmm.
And so, with that in mind, I also was put on the committee, the admissions committee, for in the beginning, in about 2004, I started, and I've been on there for close to 18 years, if I do that right. And with that in mind, I learned a great deal about what we were looking for applicants for medical schools and graduate schools. And I've also mentored a lot of the children of faculty members. And it was always a good time to basically talk to someone beyond their parents and maybe kind of direct them to where they want to develop a career that was dear to their heart and not necessarily their parents. And so a lot of people got to know me within the university, that I was someone that you could call on. And so when it came time to set up the post-bac program, they asked me, would I be willing to help them?
Well,
And
let me
okay,
take
so that's where I'm at.
No, I wanted to take an interrupt you just a little bit, because you just sort of ran into my next question. Let's just take a step back and just describe for me what obviously you've been around for the college and now the university, the School of Medicine, how it's been organized. Give me sort of a layout of all of that, if you can, especially the post-bac program, of course, too, but everything.
Okay, so how about 10 years ago, they basically asked me if I want to be part of the post-bac program. Okay. And it was three of us. They at first hired individuals with degrees in education, and they were a little bit overcome with developing a curriculum in the sciences. And we kind of thought it out that it might be a plus for the students if they had someone who went through this coursework who was part of the sciences, not just in undergrad, but in graduate studies. And so the dean of the College of Life Science at Thomas Jefferson University, which is Dr. Gerald Grenwall, became the director of the program with the dean of our master's program in the sciences, Dennis Gross, and myself. And I was basically hired at 30%, but soon my boss saw that I was doing 100%, and I would be part, teaching biology and advising. Okay. And so we started out with 10 students in the 1-year program, and in the 2-year program, we had about 18. We were happy for those numbers because our program was based on bringing students from Sidney Kimmel Medical College who attended post-bac programs. And we basically formed a roundtable, and we said to ourselves this was going to be for career changers who had Bachelor of Sciences. And our students said they wanted their own cohort. They wanted individuals who were experiencing what they would be in the program, as well as their goal to attend a healthcare professional school. All right. Our program is not limited to just medicine as allopathic and osteopathic medicine, but we have students that attend dental schools, podiatry school, and veterinarian school, as well as any type of career in healthcare, from nursing, occupational therapy. There's so many. And with that, we give them the basic sciences. So they wanted their own cohort. They wanted small classes. Many of them came from big schools, large universities, where some of them in their freshman year might have basically attended a biology or chemistry course and decided it was a little overbearing for them at the time, especially for experience of a first-year freshman. And they put it aside and went into a different direction, a different choice of a career. And with that in mind, by having a small cohort of, we range from 20 to 30 in acceptances. We like to say in the pandemic, initially it was 35 because everybody was running to a program that was online, and they thought it would be easier, far better for them to manage. Except we believe that we're giving individuals the foundation of science for medical school. And with that in mind, they were going to become biology majors. They were going to capture the foundation of chemistry. And so they wanted a small class that they could talk to their professors and know their cohort. The other thing was they wanted to be in a mecca of medicine. They didn't want to travel. They want to have all those experiences. And so this is how our program began. We are proud to say 416 students completed the program. We have at least, from what I counted, 294 that are applying to are in medical school, and I have a few this past year who are applying, but we have also 61 of that 416 who are in graduate studies associated with healthcare. And so, this is what I do. I teach. I enjoy teaching. And they say, well, if you're the director of the program, why are you teaching? You have enough to do in administrative. Yes, I have enough to do, but how will I know my students? How will I know each and one of them, career changers? They've given up so much to attempt this choice of education. And with that in mind, I wanted to know my students. So our biology classes, our arts and science of healthcare class, and our medical ethics class is basically with myself, as well as my assistant, who is absolutely wonderful, Dr. Erin Hine. And she directs mainly the educational programs, but she is an advisor for our students. Advising is basically could be 24 hours. They have my cell phone number, but we encourage them. We can help them if we get to know them. So it's stop by the office, say hello. How are you doing? We use our arts and science as an advisory program where they network with physicians of our within Thomas Jefferson University at our medical school. And but we also work with them from application to interviews. We have our medical students. Our medical students have played a big role in their lives. And they basically set up a mentor program where they match one of our postbacks with one of them. And so it's an exciting time. The office can be all about education, but the office can be about struggling and the challenges of the program. I don't know if that's how you wanted me to be directed, but that's where we are.
No, that's fine. No, I appreciate it. I enjoy hearing the stories, and I'm like going, yeah, all the lessons that you pretty much are outlining is like, yeah, that's pretty much how it should be done and organized. So I really applaud you and the administration that really set this program up. I did want to get a little bit of a more specific question, if about, because you mentioned it a little bit about processes to like work in the clinics, work with the community. Philadelphia, as you mentioned, is a really fantastic place to learn about medicine. And you mentioned people would go into graduate studies and research, and so I don't know if you have anything sort of structured, but you kind of you mentioned mentoring, you kind of mentioned networking and all of that stuff. So I wanted to see if you can just stretch that and elaborate a little bit more about what's involved and how people find those opportunities.
Okay. One thing when we started to look at all the things that they needed that make them that competent application for graduate studies in healthcare was our community. And I guess what I want to say when I think of why did I remain at Thomas Jefferson is because of one thing that describes it, and that's community. And so when we look at our healthcare opportunities, I had to reach out to my community. and reaching out to my community was saying, oh, we're having a little bit of a difficult time getting shadowing experiences. And the provost of the medical school, Dr. Charlie Pohl, basically took one of his assistant physicians in emergency medicine, Dr. Lau, and he basically works as a liaison for my students in connecting with who they want to shadow with. And it's working unbelievably. Okay, we do not set up a rotation for them, but if they, and we ask them to reach out first, and then they go to Dr. Lau, and he basically sits down and says, okay, what specialties do you want to participate in? And he sets them up with individuals within our community. We also, when it comes to healthcare opportunities, we basically have our hospitals within the university. And so within a walking block, we have Thomas Jefferson University Hospital, and their volunteer office has basically, it was very active before the pandemic, and then it basically was dissolved. And now it's very encouraging because they look at P4 students and what they did before. And so our P4 students can be a cuddler in the NICU. They could be part of the PACU, connecting the patient after surgery with their family using iPads, and also volunteering there. They can volunteer in doctors' offices. They can be part of a geriatric program, which they can go and visit patients. Sometimes an elderly individual comes in the hospital and can have psychotic episodes from being away from their home. And just having someone to visit them during the day, maybe to watch a baseball game or a football game, or just maybe read a book. And many of our students are very talented in the arts and feel they basically come in and play their instruments for the students. Some of them basically go up to the NICU and play their guitar, and it seems to soothe a lot of the babies. All right. So that's one way. We have the Hospital of the Neurosciences where they can volunteer, and also Wills Hospital. And there is a program that you could rotate on different floors with the Pennsylvania Hospital, which is only 3 blocks from our campus. Okay. We also have the opportunity, our medical school students have opened some of their facilities. Casa de Salud, Jeff Hope for the homeless population. We also have Refugee Partners. And Refugee Partners is in South Philly, which our medical schools basically, I say, have set up different opportunities from the clinic, from getting our newly immigrants acclimated to their new homeland, and also tutoring services. And our P4 students have volunteered there and even have been on their board and for different activities. So there's some of our clinical. When we think about research, it has been wonderful making connections with faculty members in the admissions committee. And some of them had internships. Our gastroenterology department has, for pre-medical students, 1 year, and they take 2 years. It's competitive internship, and it's mainly our P4 students are very interested, and they basically volunteer for the program. Those that aren't accepted for that 2-year or that 1-year program they basically place them into other positions for clinical research studies in their department. We also have the Department of Preventative Medicine that we have a professor, Dr. Stanton, who basically has taken P4 students to work on projects um, such as safety on our streets, bicycle pathways, to wearing helmets, to uh, looking at massive shootings and basically why individuals happens within the city of Philadelphia. All right. So there's lots of different projects that one could participate in. We also have academic associates. Now, academic associates is kind of a unique program where our students can, for one semester, they go and participate in clinical trials from start to finish. And they can probably work on consenting and recruiting, preparing samples obtained from the protocols and putting data into a database. And during that time, they must complete 2 rotations of 3 hours each during the week. And it's a great experience for someone who wants to become a physician, because medicine isn't stagnant. Everybody's looking for a cure or a treatment for a good quality of life. And so we want our students to experience that. Not everyone does it. You can also go down to CHOP, Children's Hospital of Philadelphia, and they have the same program in their emergency room. And they've taken many of our students. In both of those programs, our students have risen to the occasion and have obtained jobs during their gap year in helping with the program. So it's been a very powerful thing in the sciences. And in the beginning of the program, we never expected this to happen. And many of our students go out to other universities within Philadelphia, especially those who might come from a science background or who have done research. And when it comes to community services, our medical students have 56 different societies that are open except for elected societies, and I should say elected membership. And with that in mind, our program reaches out to them in tutoring, in volunteering at these in the city of Philadelphia twice a year. Young individuals in high school want to participate in sports, and they can have free physicals. So they participate in those. They participate at the Manzoni Center, where they can volunteer. They actually go up to the Broad Street Mission, where it's only 3 blocks away. But our office of engagement at the university has opened up several programs that they can participate in that are within the radius of our university, that it's not so difficult for them to travel. And that's very important.
Sure.
And
I know we have like a real short amount of time left. I'm sorry. I have to cut that
Sure.
off.
Sure.
I have one last question, and I know we don't have a lot of time, but it's the big question I know a lot of people on who come to our forums ask, and it's what are you all looking for, whether it's for your post-bac program, and you're on all the different admissions committees in the graduate program as well as the medical school. I guess just sort of a sense if there's something that differentiates someone that you're looking for post-bac versus medical school. I certainly know about the grad programs, but your thoughts about what would make someone more well suited for post-bac or for medical school or vice versa. Just what your thoughts were.
Okay, some of them are very basic. That motivation that this is what they want to do. Sometimes I have very high power students, definitely. Not sometimes, the majority of them are very high power students. Some of them have worked very hard to get where they want to be. And they still need to improve that GPA, but they have the drive. They have that they're going to do everything possible. In my office, there's a saying that time does not matter if this is your passion. And so when I see my students as well as my medical applicants, I want to see the passion, and passion comes with motivation. And what did they do about it? And, you could be motivated, but if you don't do something about it and try to say, is this for you? I don't know. It's like it's like taking your chances. All right. And so I want to see that drive. I want to see the motivation. I want to see that they truly want to be a servant of others. I want to see not just taking care of those who have physical and mental wellness needs, but their own cohort. I want them to ask for help and be able to give help. I want to know in that interview that they want to gain knowledge, but they know that knowledge means nothing if it's not shared. And I think I look for that in each individual. When it comes to community services, and I have to get them ready for medical school, but also know those who are applicants of medical school that if we don't go out to our community and work shoulder to shoulder with individual of all cultures, of all ways of life, ethnicity, of all social economics, we will never know the needs of our community. It's working with them shoulder to shoulder when they start talking and telling them what they need. And, it's those people in that community who are going to be their patient population. Medicine's a lot different nowadays. Yes, we go in for those symptoms and we try to find the cure and diagnose and the best treatments. But we have to also look at the lifestyle of our patients. And I think we start by volunteering in the community. And I wish, as physicians, I know they have very busy lives, but also to participate, if they can, in the community or teach their children along the way.
Well, your program definitely does that, and I really appreciate the opportunity to honor you, honor the university, and the whole organization to have set up these career changer post-bac programs. So thank you so much for joining us for this recorded interview, and thank you. Hopefully one day we'll get to meet. It sounds really exciting, and hopefully we'll be able to cross paths again. So thank you so much again.
And thank you so much in directing our interview and allowing me just to express my love for being able to put in the healthcare community not one physician, but many. And it's just not physicians, it's the nursing students, the pharmacists, the PAs, the physical therapists, the veterinarians, and we are so grateful. And I am so grateful for my community, especially my assistant, Dr. Hine, who basically is a big part of our program with me.
It is the best
Thank
part
you.
of doing this job. So thank you so much. I appreciate it. I'm going to go ahead, close the recording.